Hey nurses, looking for exclusive discounts? Nurse.org has you covered with deals on everything. Save big on the essentials you need to excel in your career. Don't miss out. Visit nurse.org/discounts for the latest discounts made just for you. You're listening to Nurse Converse, presented by Nurse.org, a collaborative podcast amplifying diverse nurse voices. Get ready for a dose of inspiration, a sprinkle of education, and a whole lot of community.
Welcome back to our special series on nurse innovation. My name is Colton Lord, and in this second episode, we are thrilled to introduce to you Bree Laughlin, a true visionary whose work is changing the face of healthcare accessibility. Bree is a registered nurse with over 20 years of experience, and she's also a self-described tech geek, musician, traveler, and problem solver. Her journey in healthcare has taken her from a nurse executive role at Epic, a leading healthcare software company, to launching her own health tech startup, Nurse Disrupted, right at the onset of the COVID-19 pandemic. Founded in March 2020, Nurse Disrupted provides innovative telehealth solutions, especially for underserved communities with limited healthcare access. Bree's team initially launched by offering COVID-19 screenings for homeless shelters in Madison, Wisconsin, a service that quickly made a huge impact. Since then, they've conducted over 43,500 video encounters and expanded to support mental health needs in rural healthcare, preventing over 1,100 emergency room visits and saving more than $2 million in healthcare costs. Now, Bree and Nurse Disrupted are tackling an urgent issue affecting the entire profession, the nurse staffing crisis. Their virtual nursing platform is focused on improving nurse retention and satisfaction while ensuring quality patient care, especially in acute care settings. Bree's passion and dedication to addressing health disparities and transforming healthcare access making her an inspiring example of what's possible in nurse-led innovation. In our conversation, Bree shares the inspiration behind Nurse Disrupted, her journey from bedside nursing to health tech, and her vision for the future of accessible health.
Welcome back to the Nurse Converse podcast. I have with me Bree. Thank you so much for joining us here. Talk to us kind of about your nursing background and how you got into nursing, just in general.
How did I get into nursing? Okay, well, hello, yes, I'm Bree Laughlin, founder of Nurse Disrupted, which is a virtual nursing platform. You know, I got into nursing because it was the number one. I went to University of Washington, and I was a competitor. I wanted to be excellent, and it had the number one nursing school in the nation.
Nice.
And I wanted to go to the number one nursing school in the nation. And so,
are you from there?
I applied from Seattle.
Oh,
yeah.
okay.
Yeah.
Nice. All right. So what inspired you to go from bedside nursing? Because I was reading about you. You was a kidney liver.
I was a kidney
Okay.
and liver transplant nurse right out of nursing school.
Okay. So what inspired you, and like what challenges were you seeing at the bedside that you're like, I think I'm going to start exploring like nurse innovation and entrepreneurship?
Well, the innovation was natural. I think all of it, we talk about this all the time, right? Like, to be a nurse is to be an innovator. We just don't realize it. Right. I was a tech nerd nurse from the beginning. I actually really thought about going into computer science and programming. And so, you know, when I was going to nursing school, the technology was a Palm Pilot, right? You had flip phones, kind of, like you had really early cell phones, but, you know, I would carry my Palm Pilot and feel so cool.
I don't even know what a Palm Pilot is. Should I know?
It's an antiquated piece of technology. Okay. Yeah, with like this infrared, like actually had another buddy of mine on the kidney and liver transplant floor, and you kind of had to point your Palm Pilots at each other to exchange like this really low grade file.
Okay.
But is prior to meaningful use and adoption of EHRs, we did have electronic documentation systems, Orca, an early version of Cerner, but they were very disparate, and still probably 70% of our documentation was on paper. Okay. But I always believed in pushing technology to elevate the practice of nursing, elevate the patient experience, and it's something that I just loved to do. So I was invited actually to work with my first startup company. Now it didn't have anything to do with healthcare, but it had everything to do with technology. So in 2006, I went to work for my first startup company in Seattle. And it was really fun because I could evolve that part of my career and then come back to healthcare where it would never be separated again.
Okay. I see. So I was just talking to my last guest about this. You kind of jumped into being like the innovation part of it before you were like an entrepreneur. So you kind of got the inspiration from that startup company, and then you kind of branched off into your own entrepreneurial journey. Is that
Yeah.
okay?
I mean, yes.
Yeah.
It's not that clean, I guess. But yeah. I do like to point this out. I became an intrapreneur before I became an entrepreneur.
Right. That's what we were talking about. Intrapreneur.
And so,
that's what she used. Yeah.
That's right. And so I worked for one of the big EHR companies.
Okay.
And really pushed envisioning new products, selling my product internally, getting that momentum internally to get it across the finish line. And it was really good practice because when you work for a big global software company, you do have to pitch your ideas internally in order to get momentum behind it, in order to get the resources and the developers and momentum behind it. And so what I wanted to do was solve problems. Like I was invited to go, right. I was invited to move from Seattle. Well, I actually had gone to Sacramento, but this EHR software company brought me to Madison, Wisconsin in 2012. All my family, my whole life, everyone, my parents still haven't forgiven me for leaving the West Coast.
Right.
Everything was there, but it was such an opportunity to get a big engine behind my ideas. You know, I brought my nuclear family out to the Midwest, and I'm glad I did.
Yeah. Amazing. So talk to us about what Nurse Disrupted is.
Nurse Disrupted is a turnkey virtual nursing technology platform. We are in hospitals, we work with schools of nursing, and we also, if you can believe it, are in homeless shelters across the United States. And it's a nice symbiosis between also schools of nursing who are earning practicum hours and people who really need care.
Enjoying this episode? We want to hear from you. Share your feedback and support your favorite host by completing a quick survey, and you'll be entered for a chance to win a $50 Amazon gift card. Head over to Nurse.org/podcast and let us know what you think.
Like, what hurdles have you faced in this journey, and how have you overcome those?
That's
I'm sure there's
such
been
a
many.
loaded question, right? Like, how do you start? And do you know what's funny is, like, some things, I understand that they're challenges, but, you know, first off, I'm a woman. I've been a woman my whole life, and I didn't really realize that I would be a minority business owner. It blows my mind. So I guess I didn't understand my handicap when I went in to start my own company and raise funds. I think it's something like 6% of all startup companies get venture capital backing, and something less than 2% of that 6% are female founded. Okay. It's against the odds. I don't know. I'm just like, well, let's go get it so that other women can go get it. So I understand that is a barrier that I'm up against. I guess I don't think of that. I think of winning. And I think of the success. And I think of, you know, I was solving problems and designing for this big global company. Why couldn't I do it?
Do it on my own.
For my own company. I had success. I knew that the products I was designing were very, very good. And so I wasn't coming into it as an MBA or someone as an outsider. I had been innovating, and my products had been very, very successful. So I knew when I saw it. I started Nurse Disrupted, and one of the funnest things to work in a startup and with a startup is the speed of innovation is so much faster. I can go so much faster with developing our virtual nursing platform than I could working for a larger legacy company.
So explain to me when you talk about, like, you're in, like, helping homeless shelters, like, what exactly is your role in the shelter as far as Nurse Disrupted? Like, what if you go into, like, help do in a shelter, like, what are you exactly doing there?
We're the technology platform. So what's really fun is you can Google the Today Show and Nurse Disrupted. And it's so cool because Morgan Radford actually goes in and she demos our telehealth technology platform in one of the homeless shelters that's using it. I talk a lot about technical equity and digital inclusion. It's really easy to kind of get a cut rate developer to put a lot of buttons on a piece of software, make it very complex. But it is very difficult to design something precisely in a low barrier way that addresses the technical literacy rate of the majority of Americans. So 60% of the United States actually doesn't have the technical literacy rate to expertly navigate the, 300 million mHealth apps that have been put out into the public. We design so that any user of any technical literacy rate can use our product. And so that was the design methodology that we were able to hone into and sharpen in on. We also designed to network efficiency. Being in Wisconsin and serving schools of nursing, we call it up north, you have to have low internet bandwidth, and you can design solutions And what wound up happening with the technical equity, digital inclusion design methodology, where we were solving for these wild community spaces, it wound up when we came to the inpatient space, like we were on rocket fuel. I mean, we get hospitals live in like 4 weeks. It's simple to use. It simply works. And isn't it wonderful the way that there's this, symbiosis when you design to solve a particular problem, it winds up solving a lot of problems.
I love that.
In access.
It's like, it's just bridging a gap in health disparities is kind of what it sounds like, is what you're telling me.
Yeah.
To wrap this up, Bree, kind of talk to us about, if you were sitting across from a brand new nurse, or maybe even a nurse that's been in the field for 5 to 10 years, 15 years, whatever, what advice would you give to somebody that's seeking that innovation, the intrapreneurship, the entrepreneurship? Like, what advice would you give to somebody that's thinking about taking that leap?
Okay, first do it.
Yeah.
There are a lot of sources. Yeah. However, a lot of organizations have put a lot of money and effort into developing the nurse entrepreneur. And I always love to tell people about Johnson & Johnson has a nursing innovation arm. They have quick fires. They have money. When you have an idea, you don't have to have it vetted, but you can do a quick fire challenge so that you can get the first funds to advance your idea. Yeah, totally. It's great.
Yeah.
American Nursing Association also has a great innovation arm. Their head of innovation is here today. And again, there's quick fires that allow you to get the first seed money to move forward. SONCL is a great organization that helps provide opportunities for hackathons. What's a hackathon? When you have an idea, a hackathon will help you work quickly with a group of people to develop that idea and even come up with a pitch in the end so that you can get good at marketing your product. And also, nurses, you got to think about cash money, because if you want to have incredible innovative ideas, I mean, even when I was looking at starting a platform that would work in homeless shelters, there had to be revenue generation, return on investments. That's true now with our hospital systems and whatnot. But these hackathons and these innovation resources that are provided by Johnson & Johnson and American Nurses Association, don't worry if you're like, I don't know how to put together a financial plan. I don't know how to build out an idea. These resources will help you do that. So get in there and, get your ideas out into the wild. They're going to be, people will poke holes in them.
Of course.
You will absolutely have, a humble pie every day, but you're going to make it and you're going to iterate on it. So go get it.
Gosh, I love that. You're inspiring me. I'm fired up. Well, Bree, thank you so much for being here with us. Thank you for everything that you're doing in the healthcare community and just blazing trails out there for nurses and the future generations of nurses. I love what you're doing. It's awesome. Thanks for being here with me.
Thanks for having me, Colton.
Of course.
And that wraps up this episode of our special Nurse Innovation series. We hope you enjoyed our conversation with Bree Laughlin and were inspired by her vision and dedication to healthcare transformation. But we're just getting started. There's so much more to come. In the next episodes, we'll continue to dive into the world of nurse-led innovations with more incredible guests, each bringing their unique solutions and stories to the table. If you're loving this series so far and want to hear even more inspiring interviews, we'd love to hear from you. Please take a moment to fill out our listener survey at Nurse.org/podcast. Your feedback helps us shape future episodes so we can keep bringing you the insights and stories you care about most. Thank you for tuning in, and don't forget to subscribe so you won't miss what's coming next. Until then, keep pushing boundaries and redefining what's possible in healthcare. We'll see you next time.
Thanks for joining Nurse Converse, brought to you by Nurse.org. Help us grow by leaving a 5-star rating and review on your favorite podcast platform. Nurse.org supports nurses with career and education tips, life advice, and breaking news. Thank you for all you do and for being you.